I'm here to talk about a bill that I also hope that we can find common ground on. My bill, the Expanding Health Care Options for Early Retirees Act, would allow retired first responders, firefighters, police officers, EMTs to buy into Medicare beginning at age 50. Due in part to the physically demanding nature of their work, first responders often retire earlier than other workers and can experience gaps in coverage until they become eligible for Medicare. This legislation would close that gap. Coverage under this bill would be identical to the coverage provided under the existing Medicare program. Retirees would be eligible for tax credits, subsidies, and tax advantage contributions from their former employers or pension plan. Further, the bill specifically requires that it be implemented in a way that will not harm the existing Medicare program beneficiaries or trust fund. We're grateful to have the support of the International Association of Firefighters, the Fraternal Order of Police, the National Association of Police Organizations, the National Sheriff's Association, the National Troopers Coalition, the International Union of Police Associations, the National Conference on Public Employee Retirement Systems, AFSCME, among other organizations. Many of their representatives are with us today. And since introducing the bill in September, my office has received dozens of phone calls and letters and messages from people all across the United States describing how it would help them or a family member. A person from Wilson County, Tennessee wrote to us, "This is such a needed law. More and more agencies are washing their hands of ensuring first responders when they retire. It is not a young person's job. And when we retire, we are damaged physically and emotionally and need the health care that eats up most of our pension." A paramedic from Florida wrote, "I'm 53 and can retire in 2 years. Healthcare has been my major concern after my retirement. I pray for all of you working on this proposed bill." A paramedic firefighter from Oregon wrote, "I was born to be a firefighter in the community I was born and raised in. You naturally never think about your body wearing out. I've had several Toradol and steroid shots in both my elbows, shoulders, and neck over my career so that I can be at work answering my community's calls. It would be so helpful being eligible for Medicare benefits when I retire." A newspaper in Texas quoted the head of the Abilene Police Officers Association saying the bill would allow us to retire at a good age and be able to afford health care. This affords us the opportunity to retire earlier, spend more time with our families, and enjoy life. This is why we are here today, examining how to improve our health care system so that every American can spend more time with our families and enjoy our lives so that we can choose a profession we love and to change it when we please without the crushing existential anxiety that comes from being uninsured or underinsured, without the fear that an accident or illness could lead to bankruptcy. Now, I believe that everybody who wants Medicare, teachers, caregivers, coal miners, farmers, service workers, everyone should be able to live with the dignity and security that the program provides. But as we debate how to free every American of the anxiety of dealing with the current healthcare system, let us at least do something to free the few, the dedicated and brave few who risk their health and their lives to protect us. Thank you so very much.